Congressman John Shadegg from Arizona agrees. In a recent online editorial, he wrote this: "Are you ready to be told what treatments, medicines and procedures you can or cannot have? Because rationing may be coming soon to your doctor's office or a hospital near you." Congressman Shadegg joins us now from Phoenix. Congressman, thanks for joining us. I'm sure you heard what the President just had to say a few moments ago. Make your case. Tell me why I'm looking at healthcare rationing down the road.
Well, in every nation that's gone to a single-payer system to control costs, because they have no market mechanisms controlling costs, they have gone to rationing care. In England, it's called the NICE board, and it decides what care certain people can get for certain diseases at certain ages. For example, macular degeneration, which is the loss of your sight in England. If you lose your sight due to macular degeneration at a fairly young age, they'll give you the very expensive drug that's available to treat it. But if you are threatened with losing your sight at an older age, they actually say, we'll give you the drug once you've lost sight in one eye. Well, I think the evidence is...
Congressman, towards the end of his presentation, the President said, look, he's got 3 goals for healthcare in America. He wants to stop the spiraling up in healthcare costs. He wants to keep everybody with a free choice of their own doctor, and he wants everybody to have affordable care. They're pretty broad goals. He's not mentioning single payer. He's not saying we go to a British or a Canadian system. You think he is, though?
Well, if he keeps all 3 of those promises, which quite frankly I think he's already acknowledged he's not going to do, but if he were to keep all 3 of those promises, I would be all for that kind of a system. The most important promise there is that if you like what you have, you can keep it. I think the key to healthcare reform is choice. Right now, Americans don't have choice in their own healthcare, and the costs are spiraling out of control because you and I don't get to make a choice. We can go to a choice-driven system, give everyone the health care they want, cover all Americans without going to either a single-payer system or a government program.
But it would cost you a small fortune to do that. The system you've outlined would cost a vast amount of money.
The system that I've outlined will cost a fair amount of money, but Americans should understand we're paying for health care for all Americans right now. Nobody goes without any health care whatsoever in America. Nobody in your listening audience right now drove past somebody on their way to work this morning who was dragging a broken leg down the street because it wasn't being treated. And this number of 47 or 44 million that are uninsured, those people are only uninsured for a short period during the year. Many of them choose to be uninsured because for them it's a logical and rational decision.
We're looking right now on our screens, Congressman, at the health insurers, their stocks. All of them are significantly lower in light of what President Obama had to say today. Now, give us your best guess here. Do you think the way Congress is structured, with a heavy majority of Democrats in the House and in the Senate, you think we're going to get this? It looks like a probability, doesn't it, that the President's system is going to be in place?
Well, I think it's a probability that we're going to reform health care, and I think we should. But I don't think we ought to look at the insurance industry for how we should reform health care. And I think those insurance stocks should be down. The reality is the President wants to put into place a plan that will destroy those insurance companies. What you saw today, to the extent that some of them stepped forward and said, look, we can wring further savings out of our current operations, they're trying to be at the table where the new system is signed. Indeed, many of them are pretty candid about it. They say if you go to guaranteed issue and a mandate, an individual or a business mandate, so we get more customers, we'll go along with this. That's just greed on their part. That doesn't force them to compete. That doesn't force them to deliver quality services for you and me. That just lets them be on the inside of designing a system that's going to protect the kind of sweetheart deal they have right now.
We got it. Congressman John Shadegg, Republican, Arizona. Thanks for joining us, as always, sir. Appreciate it.
My pleasure.